now I'm going to introduce the group from Disruptive Nutrition. So we have Mike McCandless, who is the founder of Disruptive Nutrition. We have Jessica Duis. I just want to get your profile appropriate. So Dr. Jessica Duis is a geneticist and a pediatrician. And she has most of her clinical research. She's at Vanderbilt University and is starting she's a medical director of the Angelman Syndrome Comprehensive Clinic at Vanderbilt. And she is, most of her expertise and her research and her passion is in Angelman syndrome and Prader-Willi syndrome. So she has really kind of jumped into Angelman in the last 9 to 10 months pretty aggressively, which has been phenomenal. And then, of course, Dr. Donna Herber, who is the Chief Science Officer of Disruptive Nutrition. They're here to talk to you today about their ketone ester supplement slash medication, medical food that they would like to bring toward our children for Angelman syndrome. So would you prefer those microphones? Can we turn these on? Otherwise, you can pass this one. Okay.
Yeah.
Okay, leave those on.
Yeah.
Perfect.
No.
I think the third one's not on. This last third is here.
We did that on purpose.
Oh, on purpose?
No, it's fine.
She's the sweetest voice, so anyway.
Yeah, no, we'll make it work. What a room. Holy cow, compared to the past 3 years. This is amazing. So as she said, Mike McCandless, I'm the founder of Disruptive Nutrition and Disruptive Enterprises. To a lot of you guys, that doesn't mean anything. You guys don't know what the company is. And I'm going to give you a little bit of background before we jump into what we're actually doing today, kind of how this company came about, try to keep you guys on track for being able to get to lunch on time, because I know how important that is. So here we go. Back in 2011, my mom was diagnosed with cancer, and like anybody who goes through a disease situation with a family member, you jump online, you start searching for as much information as possible. In that search, I came across a researcher named Dominic D'Agostino, who is down at USF, who was doing ketogenic diet research in an animal model, looking at its impact on tumor growth. And like anybody would, and contacted him and tried to see if he could help or if I could help him. Going forward about 4 to 5 years, Dom and I built a fantastic relationship. We funded an enormous amount of research in his lab, which led to a mountain of data in all types of different disease states, but all of these disease states were in animal models. And our previous history was in sports nutrition, and here we had developed out all this medical research and trying to figure out what do we really do here? Are we still a sports nutrition company, which was what was driving the funding, or are we a medical company, and do we look at this area of medical foods, which is really fascinating to us? So come into last year, well actually 2 years ago, I'm sitting on all this data. I am not a scientist, but given my inappropriateness, usually when I speak, that's pretty obvious. And so we bring Donna on board and give her all this data, and we're like, we don't know what to do with this, but we know this is a lot of really good data in a lot of different areas, but it's all animal data, and we need to get to human data, but we don't know which one to pick. There's all these different ones. She was the one that suggested that we should look at Angelman syndrome, and I'm not gonna lie, I'd never heard of Angelman syndrome until 3 years ago. And so it was her recommendation, and it's what we went with. So starting 3 years ago, we came here, presented the initial animal data that existed, came last year, talked about the furthering of that data and where we were at. And we have some really exciting stuff that I'm going to let them tell you about, because one thing that fascinates me about Angelman's parents is that as adults, you've had to go back to chemistry class, biology class, and all these other things. Your working knowledge of science is absolutely amazing. So I'm going to let them handle that stuff. So, but prior to last year's conference, 80 days before the conference last year, my mom passed away. And so, she, it's okay. So she passed away, and I had to figure out what to do. I was sitting on a lot of medical research. I was sitting on a very successful sports nutrition company. So the week after the Angelman syndrome conference, I put my company on the market and sold it March of this year. which pulling off a 120-day transaction in our world is something that just does not happen. So people talk a lot of times about what they're going to do and how they're going to help people, but it's really your actions that really matter. So sold the company, which was 93% of our cumulative revenue for all of the companies that we had at that time. Took that money, 3 months later, launched out a ketogenic diet company that focuses on food product and supplements for people that want to follow a modified low carb or ketogenic diet. And then 3 months after that, which was just a couple of weeks ago, we bought a food company that focuses on doing high-fat, low-carbohydrate food products that are shelf-stable and transportable. Because if we were going to progress with this medical research, thank you, thank you. If we were going to progress with what we're trying to do specifically, which is evolved around the ketogenic diet, my mom had terrible compliance with the ketogenic diet. I had all the data, I had the best researchers in the world, and I couldn't get my mom to follow it. And a lot of that, and I'm sure any of you that have tried to do this, I tried to do it with, I mean, granted, you know, her son was telling her what to do, so you can imagine how well that went over. But, you know, trying to get a kid to follow these things is nearly impossible. You take a kid to a birthday party where you just want your child to be normal, and a cupcake is not exactly the best thing for them at that moment, so you want to have something. Now, I know nothing about food, but I also knew nothing about Angelman syndrome 3 years ago. So we've poured the money that came from the transaction over into developing and doing a lot of research into making these things that are very transportable, shelf-stable, and not taste like crap, because you got to be able to obviously eat it. And so that's where we're at now, and I'm not going to take the thunder of what we're going to be announcing today, but I'm very excited about the information that's getting ready to come, and it was important enough to me. I flew my entire team here. When we sold the company in March, and like I said, lost all of our revenue, almost the entire staff stayed on board because we explained to them what we were going to try to do, and we knew that it was going to be a long goal to be able to do it, but they had never been here, and they never had met you, the parents, and how just unbelievably inspiring you guys are. So throughout the room are around 30 people that work for us that I wanted them to be able to come here, go to the gala, and just get this experience, because it's what's important and it's what's real. We get to actually touch it. So with that, I'm going to turn it over to Donna, because I'll end up probably crying again. So I guess she's going to go up there and run through our science slides. So thank you.
It's just me dropping things. Okay. I'm Donna Herber. I'm the scientist. People ask me all the time, what do you do? Like, I'm the scientist. We are a nutrition company. Our goal is to make dietary interventions easier. Easier for you, easier for your children. We want to get therapeutic benefits like you see on the ketogenic diet, the low glycemic index diet. But we want to make it easier. We want to make it accessible to all kids, not just those on a ketogenic diet, not just those on a legit diet. Last year I stood up here in a room half this size to a crowd about half this size and apologized because we had not gotten to the trial yet.
We're an emotional group.
On Tuesday, Vanderbilt University approved our protocol. This week, Tuesday. So here we are, December 1st, our trial is open. So we're going to go over a lot of information. We're going to go a lot over why we're doing what we're doing, and you may be tempted to take a bunch of notes. You don't need to do that. You'll have access to the presentation. Dr. Duis is going to talk about the actual trial, what it does, and how it's going to happen for your children. And at the end, we will also have a website where you can send you'll see the outline of what we're doing. This is just the shot of it. We'll give you the website information at the end of the presentation. So I ask you, and I can't do this. So if you can't do this, it's okay. I ask you to not take notes. Just listen, and then think about, maybe if you're taking a note, make it a question so that you have those questions written down so you can ask us about that. So we call it FANS because we were definitely fans of you guys. And it's a nutritional formulation for Angelman syndrome because we are a food company. Think of this as a food. So have you tried a diet to help your child? Have you ever even considered a diet to help your child? It's hard. It's hard. Just doing a diet for ourselves as healthy adults is hard. So we'll talk about the background, we'll talk about the basic science, and then Jessica will go into what we're going to be doing in the clinic with your help, what our next steps are, and then we'll be able to take questions. And we are here all day today and all day tomorrow as well. And so this is just the ketogenic diet. I hate to put food up in front of you when lunch is looming, but we're a food company. And as you can see, if you're not already familiar with ketogenic diets, they're very, very low carb, with a small amount of protein and primarily fat, so bacon rules. But there's a really, really good rationale behind having your child's body convert from a carbohydrate or a sugar-based metabolism to a fat-based metabolism, because that's what this is about. This is about a different fuel for your kids' bodies. Instead of it being glycolysis, which is glucose, which is sugar, which is carbs, it's ketosis. Ketogenic, it's ketosis, it's fats and fat-based metabolites. So this is just the EEGs we're all talking about, how if you've seen a couple of these, you can see the striking difference between typical developing brain EEG versus Angelman's. This is not typical versus Angelman's. This is Angelman's pre and post diet. This is powerful. This is powerful. So it has been tried, the ketogenic diet has been tried successfully in many children. There's a couple of case reports that were originally introduced, I guess it's been about 10 years now that we have actual documented evidence of how well this will work. So if we look at the ketogenic diet specific in AS, one of the huge background that we rely on is epilepsy. And the ketogenic diet has been used about 100 years in epilepsy to successfully control seizures, to eliminate seizures in many children who don't respond to their anti-epileptic medications, to bring them to seizure-free status. This doesn't happen for every child, but there's a significant improvement with a ketogenic diet in seizures. And this is built on the epilepsy population, the pediatric epilepsy population. So low-carb approaches, the extreme version is the ketogenic diet. A more liberalized version is the low glycemic index therapy, the legit. And again, it's low carb, but it's very specific in the kinds of carbs. So it's not the cupcake carb, it's the kale carb. You see where we're going with this. So there's still more carbs, there's more protein. And there was a recent study done by Ron Thibbert's group there's a couple of publications about it, but they saw a significant decrease in seizure frequency with this low carb approach. So this, as a food-based intervention, this can work for our kids. And my children do not have Angelman syndrome, but I love your kids, so please forgive me if I take liberties and say they're our kids too. So, interesting also, not just overt decrease in seizure frequency, but changes in brain patterns, as we saw in the EEG studies. And then some of the parents also noted developmental gains. So there's some hope there that there might be more than just seizure going on that can be improved. So nutritional ketosis, I said, okay, that's when your body's burning fat. There's different ways to achieve that. You can achieve it through dietary intervention by extremely lowering the carbs. You can do it through ketogenic fats, even if you're on a standard diet. If you consume MCT, as anybody's ever consumed, raise your hand if you've done a diet or considered a diet with your kid. Okay, So MCT oil, when administered, will also raise blood ketones, even on a standard diet. So it's not as high as if you're doing a ketogenic diet, but you can consume certain ingredients like coconut oil, MCT oil to boost it. But then there's also supplements. So recently, in the last couple of years, in the dietary supplement market, there have been ketones available, and those also directly raise ketones. So this is all this nutritional ketosis. What are you eating? What are you consuming? And then what does it do for the fuels your body's using, the fuels your brain is using? So FAST very generously funded the basic science behind our studies to just giving ketones to treat Angelman syndrome in mice. So Ed Weber and I have worked around this project for years now, and this is his data. And just in summary, we took, there are many different ketones out there. If you hear ketones, there's more than one. This is one of them, the ketone ester. And when it was given to the mice, let's see, how far do we go here? When it was given to the mice, these are the transgenic mice, seizures were reduced, but also they measured cognition. They saw improvements in learning. They saw improvements in memory. And most interestingly, they saw improvements in motor coordination. And that's the pictures I'm showing here are the improvements in motor coordination. So that was extremely interesting. So you have data in your kids with the diet that seizures are reduced. You have data in mice that with supplementation, a lot of good things happen. So what's our next step, right? What's our next step? So for us, nutrition company, this is nutritional support using medical food. So I will say this over and over again, every new person I meet. Think of it as a food, not a drug. Our studies look a lot like drug trials, but that's just because we're studying a lot of the same things and we are regulated in a lot of the same ways. But we are food. We are food. We are not a drug. So how is that different to, say, the government, or how is that different to what the marketing might look like for something like this, or how you might get access to a medical food versus a drug versus something on the shelf? So medical foods are indicated when the patient can't manage their condition solely by modifying diet. It is used under medical supervision. So this is something that you would talk with your physician about. It might be the neurologist, it might be the GP, but this is used under medical supervision because it's intended for a patient population. It's not intended for healthy people. It's intended for patients. It provides nutritional support that needs to be unique for that patient, so it needs to be designed for your kids. Not just for anybody, but for your kids. And then it's specially formulated. It's not just coconut oil, okay? It's not a whole food. It needs to be specially formulated, and it's for oral consumption. This isn't something that's injected, okay? This is actually intended to be food. So, have you tried a diet? It's hard. There's limited food choices. There can be lots of tummy troubles when you increase the fat and decrease the carbohydrates in your child's diet. Constipation can get worse. On the other extreme, there can be diarrhea. There could just be reflux issues. There can be food refusal. My 7 and 9-year-old typically developing children are really good at food refusal. So that's an issue. So it needs to taste good. And then there are social issues like we discussed, like going to the birthday party and then you have a cupcake and your kid's having, I don't know, a cashew. So it's got to fit within the scheme of what can make life not bearable, but better. So our goal is to help make the diet more manageable. We know diet improves seizure. We know this. We know animal studies show us that ketone supplementation can improve cognition and mobility. So the question is, how can we transition our kids to these alternate fuels and make it easier? And with that, I'll pass it over to Jessica. I'm so thrilled. I was telling her before I got up here that this year she gives me confidence that I've never had before. So I hope you have that too. Sorry about that.
They know that I am a crier because we've talked about this a lot. I'm also fighting a cold, so that's going to be my excuse too. But I am incredibly thankful to Donna and Mike to be up here talking about this. When I met Donna, which actually wasn't that long ago, maybe March of this year, it was, we had a lot in common about what our thoughts were moving forward to make things better on a daily basis. What can we do if you're trying to do a diet for your children? What can we do to make that easier? Because I see lots of kids and adults with Angelman syndrome in my clinic, and one of the things I've learned from you all is that it is so hard. Not only are you facing all the things that go along with Angelman syndrome, but just in society, like Donna was talking about, how do we make it easier? How do we make parents not feel upset when their child eats something that's not on the diet? That's extremely stressful. And I hear that all the time in clinic, and I see it in clinic as well. So we want to make that easier on every level. And so we are so excited to be starting the trial at Vanderbilt. And we are even more excited and a little bit shocked, but excited that we were able to get the IRB approved, and we are really ready to enroll today. So it is a 16-week trial. We'll do clinical monitoring both at home and in the clinic. And as Donna said, don't think of this as a drug. This is to supplement your child's diet. It is not supposed to be especially at this time, it's not supposed to be instead of what seizure medications typically your child would be on. It's just to help augment all those therapies. And so Donna talked about this a little bit, but there is evidence that diet does make that little bit of difference, particularly if you have a child who has seizures. We recommend the diet, especially in young kids who we're seeing that have difficult to treat seizures. And it does, I can tell you anecdotally, and then of course from the group in Boston, we know that it does make a difference. And the other thing, mostly anecdotally at this point, is it does seem to help with behavior and other things, potentially sleep. And some of that was in one of the papers from the Boston group, but it's not something that's been directly measured. So and that's the low glycemic index diet that's been the most well studied in Angelman syndrome. And with that diet, you can incorporate more nutritious carbs into the diet that have a low glycemic index, so they don't raise the blood sugar like your typical breads or more typical carbs. So what is in our investigational formulation? So just like Donna was talking about, we have nutritious fats, and we're going to be giving ketones, and as Donna said, there's different forms of them. One example is beta-hydroxybutyrate, and then it will have other added electrolytes, flavoring to make it taste good, and we'll have you mix it with water and consume it. And so these are the inclusion-exclusion criteria. We really wanted to have children who we would typically recommend the diet for. So in my clinic, it tends to be the young children who have seizures. We do know in Angelman syndrome, and a lot of people's seizures get better, so we wanted to target a population that we know has is less targeted by the clinical trials going on right now, but also the ages that we felt like would have the most benefit and we would learn the most from. The other, there are some exclusion criteria that I'll just highlight here. And if you're diabetic, for example, we don't know the effects of giving ketones into the blood in someone who's diabetic, so that would be an exclusion criteria. And then we're also going to be tracking gait on a gait tracker as well, and so not being ambulatory or being unable to perform some of those tasks would make it difficult to participate. So I wanted to talk a little bit about what a clinical trial means, and this sounds like a clinical trial, and we follow a lot of the same guidelines as clinical trials, but this is more a food, a supplement to your diet. And so, but the goal of this trial is really to study the safety and the tolerability of having your child take the formulation. We don't have any data about that, and we want to make sure before we do anything else that this is something that your kids will drink, your kids will incorporate into their diet, because what's the use of it if no one wants to take it, no one wants to use it? And we want to make sure that it's safe. You know, as Donna mentioned, there are possibilities for side effects, and we want to make sure that we know about those right off the bat before we even jump into anything else, that we know we're giving something safe and that's well tolerated in the community. This is a crossover study, which means that you will be randomized to either receive the formulation or you will receive a placebo to start, and then you will be crossed over to the opposite group. That means that everyone who participates in the trial will receive the formulation. And what's fantastic about that is we also have a baseline of comparison that's your own child. So we can see if there's a benefit, and again, benefit, it has many different definitions, but even a small benefit, we will see it, and that will be extremely helpful to have both groups for your child. Randomized, again, I talked about that. We'll make sure, we will not know what group your child is in, and they will be randomized to receive either placebo or formulation. Double blind means that our team, we will not know which your child is receiving. And then someone talked about this earlier, but we will have a placebo, and again, that's to just help really see what the benefits are and what the difference in safety and tolerability really is when someone receives a similar formulation that doesn't have the ketone in it. So tolerability, we want to see that we can come up with a protocol that is doable. We don't want to make diet harder. We want to make it easier. So we want to make sure that it's something that's convenient, that's easy for you all to do. And so we're going to keep track of that. We want your input about how we can best do this, how we can best incorporate this into your lives to make it easier for you and have a benefit for your child. And so we will have a lot of monitoring. It will be a lot of work to participate in the trial. And I will highlight, hopefully, that there's a tremendous number of benefits for all the hard work that you'll put in. But we're going to have you keep a food diary of exactly what your child's eating, and then also keep a diary of seizures. We will provide you with an iPad so you can keep track of all of this. And one of the other things we'll keep track of is the GI effects of the medication through one of those, through the formulation, through one of those apps. And then we'll also be keeping track of ketones in the urine through dipsticks. So we will teach you how to take urine either with a cotton ball. We will have many different methods for you all to make this a little bit easier, but we'll have you take that urine and keep track of ketones during the trial. And we have talked a lot about what's the best time to take the ketones and how to best utilize that, you being able to do that at home to really understand if this is helping. And so we will have you record that daily. And then we'll also look at the serum ketones during the visits. So with the visits, there will be a total of 4 visits, but 3 more intensive visits. The visits will include measurement of height and weight. We will do blood sampling, and again, that's to check the ketone levels and just assess whether the formulation is safe. And we will also get EEGs at these times. And we also will do a similar thing to an EEG, which some of you may have heard this talked about already, but something called ERP, or event-related potentials, which is similar to the cap that they put on for the EEG, and it looks at cognition. And then we'll also be looking at mobility and doing some gait tracking. So I just want to take a minute to go through the study. So we will have a baseline visit where we will do all of these things. And we will also, that will be the time where we'll get you really set up to do some home monitoring and have the iPad set up. And then there'll be a 4-week intervention period where your child will be randomized to receive formulation or placebo. That will be about 4 weeks. We'll give you, and during this, towards the end of this intervention period, you'll have an appointment to come back and do all of these things again, and then we'll have a washout period, and then you'll be randomized to the other arm of this for your child, which will be either placebo or intervention. So it's definitely a lot of work to participate in the study, and we recognize that up front. But we do think there's a ton of benefit to participating. One of the benefits is that you will get all that information about your child, and we will look at that also from a clinical perspective, and we think that will have some help in making recommendations for therapy. So that's one benefit. The other benefit is that your child will receive the formulation. And what's really nice about the study is we will be able to look at your child's baseline, your child on placebo, and your child on the formulation to really tell you, is there a 5% better? Is there a 10% better? Is it a 75% better? And we'll be able to look at your child as an individual and then look at it as a group. And it certainly will be helpful to the future of trials for kids with Angelman syndrome. And so I think that's a huge benefit as well to participating. And this is really the first step. As Donna said, there are lots of formulations of ketones, and this is our first step to really understanding whether there's benefit. So next steps, if you're interested, we have a website set up where you guys can go on, and Donna mentioned that already. And then if you're having any trouble, any questions, or you're interested in the trial, you can also email our clinic at angelmanclinic@vanderbilt.edu. This is our wonderful team, and we would especially like to thank Terry Jo, who I don't see in the room, but she's been a fantastic advocate and helped us get our outcome measures and everything in order to make this the best study possible. Thank you.
So we have time for questions. So I assume there'll probably be plenty of questions. So raise your hands really high, and the runners will.
Are these on now? Okay, that website was angelmantrial.com for those that could not see it. I was actually shocked that name was available when I went to buy it. So.
Hi, my son wouldn't be qualified for the trial currently, but I'm curious, because it's not an FDA-approved supplementation, is that something that we can access without being in the trial?
The formulation has been designed specifically for kids with Angelman's, and so nothing like it is available outside of this trial at this point. So once we get a read on safety, then we'll be able to be offering it in the same fashion that other medical foods are offered. So you may see things on supplement sites, you may see ketones on Amazon with Prime shipping, but don't you do it, not for your kids. Because this has been designed specially for your children at the right serving size, with the right ingredients, to be able to see if there's going to be a benefit. And the other products on the market are for healthy adults ages 18 and older, and they're not dosed. I mean, we provide servings of food. We don't provide doses of drugs, but they're not dosed and formulated for your children.
Yep. Yep. Can you?
You said that the child has to be on a ketogenic or an LGIT diet while they do this trial?
I'm sorry, I didn't go over that in enough detail. So there will be 3 arms of the study, and everyone will be eligible. So that we'll have individuals on regular diet, standard diet, LGIT diet, and ketogenic diet in the study.
Okay, so if your kid is on one of those, like the LGIT or the ketogenic diet, once the study ends, do they need to continue on that to still stay on this supplement, I guess, if that makes sense?
So when the study completes, we certainly will be looking at the data to see if there's benefit to using the formulation. But like most studies, the plan would be for the child to come off of the supplement at that time.
And so it'll be your decision about whether or not your child continues through their diet. It will be important that whatever diet your child has been on for the 3 months prior to starting the study, that they just stay consistent. And if there's any big changes, that you just tell us about it. That's why the food diary is going to be important, to be able to see if something unusual happens in ketone levels or other things, that we can kind of tie that back to what fuel your child was using at that time. That's all.
Thank you.
Oh.
Go ahead over here on the left.
Okay.
Yep.
So my name is Sally. I just have a couple of questions. First of all, is how long is it? So once you guys have finished the trials, how long is it before it goes onto the market? And we've got a bunch of Aussies here who'd love to know if we can participate in Australia at all.
I'll take the first one there. Assuming that, we have results that we like and that the parents are happy with, there will be product available immediately. So it'll be formulated on the side. And to give some perspective, the previous company that we had specialized in flavors. I mean, that's what we were known for. And if you were here last year, you saw me bartending up at the front with a drink. And so, the drinks that we are using are naturally flavored, no artificial, colors, flavors, sweeteners. So, which is a bit more of a challenge, but I feel really good about the drink that we have right now. It tastes really good. So, yeah, once done, yes, we will make sure that it's available.
Once we get a readout that it seems to be safe and well tolerated, we don't have any limitations on them being able to offer it. We have limitations on what we can say about it, but we will be able to offer it for nutritional support as soon as we get a read on whether or not it's, raising blood ketones regardless of diet, right? Because that's the whole goal, and that the kids seem to tolerate it pretty well. That'll be important, and then at that point, we'll be able to offer it. So it should go a lot faster than other processes would happen. So.
I want to be clear, our goal is to get the most benefit possible for your kids without this being a drug that allows all of you to be able to buy it over the counter at a very affordable price, which is the entire point of all of this. So you will hear us constantly mention, it's a food, it's a food, it's a food, it's a food. This is not a drug. We are going to monitor lots of things, though, during this trial. So just, yeah. HR would tell me to stop talking now, probably. Yes, right here, dead center. Yes.
Hi, could a child who is currently vegetarian participate in this trial, or is there a plant-based version of this study?
The current formulation is not vegan. There are trace amounts of milk product in it. That doesn't mean that we could not, if this, gets to the point that it's successful, that we could not formulate. It would be easy to formulate it vegan, but right now it does have very small amounts of milk product in it.
But I think she's wondering if the diet excludes.
There's
Is that what you're?
There's really no dietary exclusion.
I mean, we kind of chunk you into standard, legit, and ketogenic because we're really curious what's going to happen in each of these metabolic places. You know, each kid would be using a slightly different fuel. So there really are no dietary exclusions, but they'll be kind of chunked based on pretty much how much carbs they're consuming.
Along those same lines, as a parent of a daughter who has a very significant milk or dairy sensitivity, I think it's very important that we know, because I think a lot of kids in the community do have a dairy sensitivity. And if there is even traces of milk protein, even the little amount of lactose that's in a pill that's a filler for a capsule can affect our kids tremendously if they have a dairy sensitivity. So everybody in the audience needs to think about that, and I didn't know that there was any dairy in it, but there are kids that have significant dairy sensitivity. So keep that in mind, because if my kid takes one little supplement like a vitamin that has lactose in it, she does have significant issues GI-wise. So keep that in mind.
And if you don't know that, I mean, this is one of the questions, right? Whenever you do a dietary intervention, this is true when you do any intervention. What are the benefits that you're getting from it, and then what are the side effects? And and do the benefits outweigh? Are we making your life easier? Are we making your life harder?
We don't want to cover up a therapeutic potential.
Correct.
Because there's a reaction to dairy, but if that reaction didn't happen, there could have been a major impact.
Yeah.
So it may be worth not having kids that have a dairy sensitivity in your trial.
Well, I think we have on the exclusion criteria allergy to any study ingredients. So.
Oh boy, you've in the very back. You've had. Would it be? Yeah.
Yes, yes, absolutely. We can put it into water like you would drink it, and we can put it through a G tube as well. Absolutely.
That's considered oral administration, so it's okay. We can't do like a sterile formulation, but that's a whole different ball of wax. But anything that can be administered orally.
Anybody else? Yep, sure, go ahead.
Yeah, first I want to thank you guys for sharing your passion with all of us here. Really appreciate that.
Don't start crying.
So,
That's
and I
my
may
job.
have, it's a nice way of saying it.
Yeah.
Share your passion. I may have missed it, so I apologize. But if you do get accepted into the trial, since the purpose of it would be to kind of help with any seizure activity, mostly, would we need to be stopping any of the existing medications we're on during the trial, or keep that during?
We want actually to make sure that you stay on everything that you're on when you start the trial, so that we're not changing any of that, and that we have you at where you are normally at baseline. Yeah, this is not a drug. It's not meant to treat seizures. We're simply looking to see if, as an adjunct supplemental therapy, if it's helpful.
So if you do have any changes to your child's medication while they're in the study, just, we'll need to know. That's all. We'll need to know. It doesn't mean necessarily that you'll not continue with the trial or you will continue. Just we need to know any changes in diet, any changes in medication, like changes in general in your child's health will be recorded through the tablet apps. And I hope those are going to be helpful. I'm a paper person. But I do hope that the apps and the tablets that we provide will make that a lot more straightforward and consistent for you for monitoring how your kid's doing.
This is not a big drink either. This is, you can mix the formulation in probably 4 to 6, upwards of 8 to 10 ounces, just depending on flavor. I mean, obviously, the more water you put into it, the more it's diluted. So, this is not you're not drinking something this size. So don't have this vision of a, big Slurpee or something you got to take down. It's a relatively small drink.
Yeah, it's a small amount 3 times a day. So. It's not a huge chunk of thing. And also it mixes well with some foods. So if your child doesn't like drinking it, we really don't care how they consume it, just as long as they can consume it.
The goal being to have ketones being present, throughout the entire day, hence the 3 times a day administration. So
like food.
Yeah, just like food. So what happens, if you have a kid that's not on a ketogenic diet, eating a normal diet, but has ketones present? And that's kind of what we're curious about. So,
Any other questions?
Yes.
Hold on, let me give you the microphone.
Yeah, she's asking if calorie-wise, is she adding any additional calories with the supplement?
So it depends. It's going to be, the serving size is going to be based on your child's weight. So, you know, a 100-pound 11-year-old is going to get a larger serving than a 40-pound 6-year-old, right? So it kind of depends on that. I think if you consider 11 being the top age range and say 100 pounds being the maximum weight, then it might be a little over 100 calories across the day, not 300 calories, but you know, across the day. So it does provide fuel, because that's what calories are, it's fuel, but it's not a huge impact.
We have another question over here.
Sorry, 2 questions. If your child doesn't have regular seizures, are they eligible for the trial? And second question, are you enrolling and evaluating non-deletion angels separately? Because we have kind of a mom's group that we've studied some different diet things, and it appears that some of the positive impacts are not affecting non-deletion angels as much as they are helping the deletion. So I'm curious if you guys are measuring those populations separately.
So if your child doesn't have seizures, yes, we are still interested. It's the age range, and a lot of this comes out of the dietary studies that have been done previously that show there might be benefits beyond seizure control, as well as the preclinical models that indicate that there might be benefits beyond seizure control. So we are definitely interested, and there is no intent at this point to differentiate between the different genotypes. That is part of the process of knowing what that genotype is. You know, that I think the maximum enrollment we think we're going to have is 30 total. So I don't know if we'll have enough to be able to say, well, this genotype had this response and this genotype, because we also have different diets, right? We're trying to do all are, you know, within an age range, all are welcome. You know, within this age range, let's see if we can truly do what we want to do, which is bring the ketogenic diet benefits regardless of your diet.
And this being the first...
Somebody said something about Australia.
Whether or not they could be enrolled if they were in Australia, which would be quite the trip to Nashville, Tennessee.
Yeah, so we have just the one center right now because Terry Jo hounded me like a dog and would not let me go. And she introduced me to Jessica, who gives me confidence that we can do what we want to do. So we had to start somewhere. Once we have kind of an established concept of how well we're doing, then of course it makes sense to open it up to broader areas. But we take all comers. There's no U.S. only requirement. You know, we're not looking at what your citizenship is before, you know, you can come in. But it is at Vanderbilt.
I mean, our goal, this is the shotgun that you start out with and then try to get as much information as we can. But this is about step 3 of 10 of where we want to be. So in the background, there'll be continual work on new technologies that we are working on big time going on in the back. And then, you know, trying to focus on what the next studies end up looking like, because this is not going to be the only study that we do, but we have to get this one done to set baseline so that we can do those other things. That's why compliance is huge, because it's what's going to set the stage for all of the other studies. And all of this, like I said, everything will be available, you know, after the trial closes, we get any of the benefits. This is not going to be the pharmaceutical company that charges $750 for a pill that's like $5. You know, this is a very cost-efficient formula. I mean, I don't want to be held to it exclusively, but if I had to guess, if you're wondering how much this would cost over the counter for a year supply, assuming you were giving it 3 times a day, if you went over $200, it probably would be a little surprised. Is what we're trying to show.
Our CFO is here. I'm sure he's glaring at us.
Yeah. So shh. So, but yeah, you know, this is not a therapy that we're looking to try to sell for, you know, $1,000 for a year supply. That's not what this is about. So, we'll make it as cost efficient as possible.
Any other questions? Great. Well, speaking about food.
Yeah, I know you guys are hungry. Thank you so much for hanging around. Appreciate it.